Hey everyone, Dr. Adam Harcourt here. Today I quickly want to go over the migraine spectrum. And so the migraine spectrum I use to help people understand the fact that if you are prone to migraine, unfortunately you're always prone to migraine, but that doesn't mean you have to have them all the time. So on my migraine spectrum is people that unfortunately have migraines all day, every day. And on the other end of the spectrum is people that have them every decade or so. Both have the genetic predisposition to migraine, but obviously you want to be down this end of the spectrum as much as possible. And so this is really important to understand as you're going through different treatments and therapies, because if you're at 25 or 30 migraines a month and you do anything, whether it's medication or diets or exercises, whatever it is, that brings you down to 15 or 10 a month, that's fantastic. Now, 10 to 15 migraines a month is still awful. So obviously you want to keep moving down, but the fact that you're so much further down the spectrum is great news. It means you're going in the right direction. So the thing that takes you from 25 to 15 may not be the same thing that took you from 15 down to 5 or down to 2 or down to none during that month. So it's really important to appreciate the good progress that you're making as you're moving down the spectrum and realize that maybe it's something completely different that's going to keep moving you down that spectrum, so you're getting closer and closer to that once a month or every other month or once a year or every decade or so. The other thing that I think is really important to understand is the further down that spectrum you are, the much more difficult it is to move down the spectrum in general. So this is why I really advocate for people that as they start increasing their frequency from 1 a month to 2 a month to 3 a month, you really want to start getting aggressive with treatment, because once you get to the 8 a month, 12 a month, 15 a month, they start perpetuating and it's harder to move down the spectrum. Now, that being said, a lot of our patients have 20 or 30 a month, so we see this all the time. But again, it's much easier to take somebody from 4 a month down to 1 every 6 months than it is to take somebody from 30 a month down to, say, 4 a month. So again, you just have to push, the snowball just gets bigger the further down the spectrum you get. So again, if you notice yourself going down the wrong way and you're increasing the spectrum, make sure you do everything you can possibly do to push the other direction. And if you are at this end and you're seeing some progress and you're going in the right direction, celebrate those wins. Even if you're still getting the migraines more frequently than you'd like, realize that you're doing a great job moving down that spectrum and trying to get your life back.